If you wake up every single morning with a mouth that feels like a desert, lips that are literally stuck together, and a scratchy, unpleasant sensation deep in your throat, your body isn't just thirsty, it is screaming a warning at you. This is not a normal part of aging, and it is certainly not harmless. Behind this seemingly simple discomfort lies a medical red flag that most people completely ignore until it's too late. This morning, dryness is often the very first sign of a silent disease progressing inside you without a single other symptom. Every morning that you shrug this off, you are allowing your vital systems to weaken. In the next few minutes, I am going to reveal exactly what your cells are trying to tell you and, more importantly, the immediate steps you must take today to protect your long-term health. If you find this information eye-opening, give me a quick thumbs up right now. It truly helps me continue bringing these essential medical insights to you. I am Dr. Ben, and over my decades of clinical experience, I have sat across from thousands of patients who sat where you are now, dealing with this exact symptom. I can assure you that behind that dry mouth lie medical truths that almost no one has ever properly explained to you. Let me share the story of a patient named Mr. Bernard, a 68-year-old man who lived a vibrant life but had a nagging problem. For 3 years straight, Bernard woke up with a parched mouth, chapped lips, and a thirst that felt unquenchable. He chalked it up to the summer heat or just getting older. He would simply stumble to the kitchen, gulp down a massive glass of water, and go about his day, never giving it a second thought. But one ordinary Tuesday, Bernard collapsed on his kitchen floor. When the paramedics arrived and got him to the hospital, the doctors were stunned to find his blood glucose levels were 3 times higher than the healthy limit. Bernard had been living with undiagnosed type 2 diabetes for years. That dry mouth was the alarm bell his body had been ringing every single sunrise, and he had simply never listened. Unfortunately, Bernard's story isn't a one-off case. In my years of practice, I have seen dozens of similar tragedies where a trivial symptom was actually the shadow of a serious condition moving in silence. So, what is actually happening inside your body when you wake up feeling like you've been eating sand? Saliva is so much more than just water. It is a sophisticated biological fluid produced by your salivary glands, and it is the front line of your immune and digestive health. On a normal day, your body produces between 1 and 1.5 liters of saliva. This production is constant, though it naturally dips during the night while you sleep. This is why a tiny bit of dryness upon waking is normal. But there is a massive, dangerous gap between a slight morning thirst and a completely dehydrated mouth with lips that stick to your teeth. When your mouth is bone dry, it means your saliva production has plummeted far below the levels needed to keep you safe. We call this condition xerostomia, and it is a medical emergency in slow motion. Saliva is your mouth's natural armor. It neutralizes the acids from bacteria that rot your teeth. It contains enzymes that start the digestion process the moment you chew. It lubricates your throat so you can speak and swallow without pain. It even fights off fungal infections. Without enough of it, your entire oral and digestive ecosystem begins to collapse. I want to reveal the 6 primary reasons why this happens, especially in people over the age of 60, though most people are never told these causes. The first, and perhaps most common cause, is medication. If you are managing blood pressure, heart health, cholesterol, anxiety, or depression, your pills might be the culprit. Over 400 common medications are known to shut down saliva production. Diuretics, for instance, are designed to flush water from your system to lower blood pressure, but they often take your saliva with them. Antidepressants can alter the nervous signals that tell your glands to work. I remember a patient named Mrs. Colette, 74 years old, who was on 5 different medications. She lived with constant mouth pain from dryness, but never suspected her prescriptions. Once we reviewed her list and worked with her specialists to adjust the dosages, her saliva flow returned to normal in just weeks. The second major cause is diabetes. Just like with Mr. Bernard, when your blood sugar is high, your body tries to flush the excess sugar out through your urine. This creates a cycle of constant fluid loss and chronic dehydration. Your salivary glands are essentially left with no raw material to make saliva. If you have a dry mouth coupled with extreme thirst, frequent bathroom trips at night, and unexplained fatigue, you must get your blood sugar checked immediately. The third cause is nocturnal mouth breathing. You might be breathing through your mouth all night without even knowing it due to nasal congestion, a deviated septum, or the much more dangerous sleep apnea. Imagine pointing a high-powered fan at a wet sponge for 8 hours. That is exactly what mouth breathing does to your delicate oral tissues. One patient, Henry, snored heavily and always woke up with a sore, dry throat. After a sleep study, we found he had obstructive sleep apnea. Once he started using a CPAP machine to normalize his breathing, his dry mouth vanished instantly. I'll get to the final 3 causes in a second, but I have a question for you. Have you ever actually mentioned this dry mouth to your doctor? Most people feel it's too small of a detail to bring up, but as you're seeing, it can be the key to catching a life-threatening issue. The 4th cause involves autoimmune diseases, specifically Sjogren's syndrome. This is a condition where your own immune system mistakenly attacks your moisture-producing glands. It often presents as dry mouth and dry eyes simultaneously. While it's most common in postmenopausal women, it affects men too. Studies suggest 4% of seniors have this and don't know it, simply because they assume the dryness is just getting old. 5th is chronic dehydration. It sounds simple, but as we age, our natural sense of thirst actually weakens. You might not feel thirsty, but your cells are starving for water. If you aren't drinking at least 1.5 liters of water throughout the day, your glands simply cannot keep up. Finally, the 6th cause is lifestyle habits like smoking and alcohol. Tobacco irritates the mucous membranes and stunts saliva flow, while alcohol acts as a potent diuretic that dries you out from the inside out, especially if consumed in the evening. If you ignore this, the consequences are severe. Chronic dry mouth leads to rapid tooth decay because bacteria are free to feast on your enamel without saliva to stop them. It leads to oral thrush, a painful fungal infection, and can even cause malnutrition. When your mouth is too dry to swallow comfortably, you start avoiding healthy, crunchy foods, and your nutrition suffers. Have you noticed yourself struggling to eat certain foods lately? Tell me about it in the comments. Your story might help someone else realize they aren't alone. Now let's talk about solutions you can use right now. First, hydration is key, but don't chug a gallon of water right before bed. You'll just be up all night using the bathroom. Instead, sip small amounts every hour. Carry a bottle with you. Second, get an air humidifier for your bedroom. Keeping the air between 45% and 55% humidity prevents the environment from sucking the moisture out of your mouth while you sleep. Third, bring your full list of medications to your next checkup. Never stop taking them on your own, but ask Dr. Ben or your primary physician if there are saliva-friendly alternatives. If you value these health secrets, I invite you to join our community here. By subscribing to the channel, you get weekly videos that break down complex medical issues into simple, actionable advice. Click that subscribe button and turn on the notification bell so you never miss a life-saving tip. I also want to give you a traditional remedy that I've seen work wonders. I call it the gland starter. You need 3 things: an organic lemon, a teaspoon of high-quality honey, and a glass of lukewarm water. Every morning, squeeze the juice of half a lemon into the water, stir in the honey, and sip it slowly, swirling it around your mouth before swallowing. The citric acid provides a natural shock to your salivary glands, forcing them to produce fluid, while the honey coats and protects your membranes. Try this for 3 weeks and see the difference. You can also use sugar-free gum with xylitol during the day. The mechanical action of chewing stimulates the glands, and xylitol actually helps protect your teeth from the bacteria that thrive in dry environments. Also, focus on water-rich foods like cucumbers, melons, and celery. These provide hydration and mechanical stimulation simultaneously. Try to cut back on caffeine and heavy salt, as both act as moisture thieves in your system. Remember the story of Mrs. Françoise. She mentioned her dry mouth in passing, but didn't think it mattered until she started losing weight rapidly because she couldn't swallow her food. Because we caught her Sjogren's syndrome early, we were able to save her quality of life. Don't let a small symptom become a big tragedy. If you've been feeling this way for weeks, book an appointment. Tell your doctor about the thirst, the fatigue, and the dryness. Your oral health is the gateway to your general health. Don't let it crumble. I hope this helps you take control of your well-being. If it did, please like, comment with your thoughts, share this with a friend who might be suffering in silence, and subscribe with the bell button on so you're always informed. Take care of yourself, stay hydrated, and I will see you in the next one.